Hey guys, Don back here. This is going to be setting up protocols and treatment plans. This is going to be a lecture for the AAPPM, but I'm giving it to everyone here because you might find it beneficial. This is going to be for a new doctor, so I'm going to focus more on kind of how doctors can set up their own protocols and kind of what's worked for me in my office and how to set up protocols as a new doctor, how to develop your own treatment plans, and how to use technology to streamline this. So why you need protocols and treatment plans? I find that this helps us to have to think less and we can be more structured and we can not be in such a rush. Many times if we're in a rush, what I used to do is if I was rushing, I would just say, okay, we're gonna do a cortisone and I'll see you in 2 or 3 weeks. And that was it. I wasn't really comprehensive and the patients weren't getting a comprehensive explanation. So it improves compliance and it improves communication. One thing that's really helped me is if I want to add a new treatment. So for example, we added Swift recently. I just added a slide to my slide deck that I was using, and I just added it to my treatment sheet and it made it a lot easier. So I'll share that with you in a little bit. You can just add that. You can simplify your explanation of complex conditions by using little videos. For example, when I do like a speed bridge for the Achilles, I can show them a little video. It just makes that video a lot easier and I can add that to the presentation, makes it a lot easier for the patient. And you can improve the per visit value because you're more comprehensive and you can help them more. And it also helps the patient experience because they all get the same experience. So how do you do this as a new doctor? Once again, this is for new grads. Shadow the current doctors and see what's working. I would recommend writing out what visit 1 and visit 2 recommendations are for each diagnosis. I think beyond visit 2, it's kind of hard to do that. So I just say number 1 and number 2. Do it for the most common conditions: plantar fasciitis, Achilles tendonitis, nail fungus, bunions, neuromas, and steal other treatment sheets. So if you look here, these are my treatment sheets, and you can certainly feel free to kind of steal these. If you go down here, here's my treatment sheets for Achilles tendonitis, for ankle sprains. Now, I don't print these out for every single patient. Most of the time I use a little, for musculoskeletal things, I'm using a treatment sheet that I can just fill out by my hand. But a lot of times the most common ones I hear are like my nail fungus treatment sheet. And there's for arthritis, for bunions, for everything. So if you want to see mine, you can certainly go ahead and do that. How to develop your own treatment plans. So develop a standard process. I'm a big kind of process person. So every musculoskeletal thing, they're going to get imaging, your exam, your kind of way of explaining things. I like PowerPoint or Google Slides to explain things, just makes it a lot easier. Sometimes when I'm in a rush though, I'll just do just the treatment sheet. So I'll print that out. Also kind of have a method of how you go through things. I think this is important. So you do your x-rays. Second visit, I tend to do ultrasound. First visit, I'll do a gait exam. First visit, I'll do the physical exam, the findings. I have a script and I have a presentation that I'll show them, and I have like a video recording. So because they're not going to remember everything you go over with them, so I send them a video. It's like a blog with a video and explanation written out. These are my treatment sheets that I have for every condition. Just makes it a lot easier. You can just, when the patient comes in with a condition, the staff can print those out or leave them in folders and they'll put it in your room. It just makes it a lot easier to see the patients, to know what to expect. Develop patient education content. Like for example, what you want to use. Sometimes you might use like a rubber band to show the plantar fascia. That's a visual aid. You could use a foot model. Many times I'm using foot models to show midfoot arthritis or the way their foot pronates on that, or way an orthotic fits. I have orthotics. I can show them as visual aids. Dynamic demonstration I think is good. I always show them, like when I try to dorsiflex their foot, they have equinus. I can show them that. I can show them their heel instability and how stabilizing the heel with my finger can stabilize their whole foot so it doesn't shake as much. Those are things that are important. You're going to figure out how the other doctors explain things, but I think that's important to have explain to them kind of what's going on. And then practice. I would also behoove you, if you're a new doctor, record yourself talking. You're going to see that you use a lot of ahs and a lot of ums. You're very maybe indecisive. And you could listen to it with one of your senior doctors and they could give you some tips to improve. Also, when you're with a senior doctor, I'm a big advocate of recording their spiel. So record their spiel, transcribe their spiel, and learn their spiel. It's kind of like in surgery. You want to learn the way the other doctor does it first, and then you can ad lib on your own later on. This is an example of what I find helpful. This is for patient presentations. If you want to learn about this, go to patientpresentations.com. At the top of each one of these diagnoses, you'll see my treatment sheet right there. So you can look at my treatment sheet and print that out. And so the way I use this is for like warts when they come in. Is it a wart or a callus? What are they caused by? Where did I get it? How can I get rid of it? When should I just remove it? the combination treatments, and I talk about Swift. This is the new slide I added, and so I talk about Swift for them. So this is what I do for warts, and then I either print out the treatment sheet or sometimes I'll just talk to them about that. This is the other treatment sheet that they can do here. I kind of check when I'm seeing them back, what type of treatments they're going to be using. Some certain notes that I want patients to know about. Specifically, Swift speeds up healing by 50%. It's 85% effective with less than 1% of recurrence. So the main things I want them to know, I'll put them on the sheet. This is mimicking what's on my blog as well, okay, that I'm going to send to them. Same thing with plantar fasciitis. I have certain questions I ask them, go through the anatomy, go through the ultrasound. This one slide is the reason I do so much ultrasound, is I show them what the normal side looks like and what the thick side looks like. And I'll say, we'll do that at the next visit. And then I put this treatment evaluator. You can certainly steal this if you want. Talks about what treatments are most and least effective. So you can get this, go to patientpresentations.com. You can get this link. Once again, my treatment sheet for plantar fasciitis, I add a QR code with educational content. And this is going to be a blog. Once again, it goes to my blog and it gives them information. And the staff print this out. And this is just what I do. I try to put it into categories because I found that was easier. Imaging, repair and heal, reduce inflammation, reduce tightness, and reduce stress and strain. I like the category method of doing it, and I check off what I'm going to do, and then they bring it home and they can bring it back the next time with them. Once again, the patient presentation for nail fungus, same thing. Goes over how I treat nail fungus. The liver concerns, I have a slide on. My treatment, I kind of start with Lamisil, then I can go to diflucan, and then I can go to Sporanox. Talks about these additional things. And once again, this is my treatment sheet that I give them. And this is why I do so much of the self-pay UV light. So I go through this first visit, nail samples, second visit, liver results, or review the results, liver LFTs. These are 2 clinics nearby that they can get the LFTs drawn. I talk about oral antifungal daily and then biotin daily with iron and zinc, helps the nail grow faster. The third visit, this is what I do for my booster. Then I put this laser here as more of an anchoring technique. If you watch my other lecture, it's anchoring because laser is $1,500. And I just really don't think it's as effective as the oral. And I usually use it as an anchoring. It's like $1,500. But all these other things that you're going to buy, the UV light, the shoe spray, it's only going to cost you $200. And so they're okay with doing that. A few other reminders for them. And this is kind of the treatment process. This helps me do more UV light and spray, and I have really no resistance at all. So anything that you don't want resistance to, you want to explain how they would do this and show how to use it, not just what they need to buy, how they're going to use it. So daily, weekly, and monthly. This is my other treatment sheet that I use for musculoskeletal things. I'll put the information in there. I'll actually do this in front of the patient and I give them this. So I check off what I did that day and I'll circle what I'm going to do the next day. This is what I use for musculoskeletal things. This is the second visit where I'm talking about ultrasound that I did the second visit. And really for I don't know, if this is how you do it, this is what works for me. If ultrasound is really what determines shockwave and amnio. So if there's a lot of thickness, that's when I recommend the shockwave. And if there's like a little tear in there, that's when I'm going to recommend the amnio. There's brace sometimes I recommend. You can also watch YouTube to learn from others. You're going to laugh, but sometimes I watch how others treat warts or what they talk about with warts or what they talk about with nail fungus, and I'll glean that and I'll add that to my treatment sheets, or I'll add that to my presentation. For example, another type of a medication I want to try, adding Qtenza, for example, to my neuropathy protocol. You can learn this from others. You can also get literature consensus. Here's one on heel pain. You can look at that. And really, I think the key is to simplify, because patients can get most of this stuff online. They're going to watch others' videos, but you want to simplify it for them. And then I think orchestration is important. So developing a consistent experience with patients. One thing I do a lot is that patients talk to each other. So they get the Pelto special, which is, my staff knows, that's the foam rolling, the morning stretch, and the night splint. So the staff knows what to expect. And then I also use my staff. So I'm going to say, no, I'm going to transfer care to my assistant and they're going to get you the rest of these things. Or my staff are going to make these appointments on the way out. That makes the handoff a lot easier. How to use technology to streamline your protocols and treatment plans. Once again, put them on your website. I use a blog, a simple blog. Each condition has a blog with a video and a description. And I send that to patients, and you can put that on that info page on that condition. Send it out before the patient visit, because those are the most motivated patients that have actually watched your videos. Do this in either like a new patient page or a welcome packet. So you could have a new patient page with all the information there. You could show them during the video or during the encounter. I used to do this. I used to have them sit in there with an iPad and watch my recording. I stopped doing that just because the orchestration was a little bit challenging. So I show them a abbreviated version of the slides, and then I send them the video to watch at home. Once again, send them the video, give them the treatment sheet. We've done webinars for our staff, or for our patients, and they'll watch the webinar, and I'll record those webinars, and I can send them out to patients afterwards, and then place a QR code to give them access to the video. Okay. So once again, I hope you found this helpful. If you want to learn more, go to Podiatry Practice Mastery, and hope these were worth your time in learning.